We have now administered approximately 173,000 doses of vaccine across the province. More than 69,000 Albertans have now been fully immunized with 2 doses. Over the last 24 hours, we identified 273 new cases of COVID-19 and completed about 6,100 tests. Our positivity rate currently stands at about 4.5%. There are currently 235 schools under alerts or outbreaks, which is about 10% of all the schools in the province. Together, these schools have seen 840 cases since January 11th. We have identified 11 additional cases of the variant since yesterday, and on average, variant cases have accounted for about 3.5% of our new cases in February. There are currently 324 people in hospital, including 53 in the ICU. Sadly, I must announce that 16 new deaths were reported to Alberta Health in the last 24 hours. Of these, many were from December and have now been identified post-mortem as being caused by COVID-19. As a result of this thorough process, we are able to report the most accurate total possible. For the past week, the R value in our province was 1.03. This includes 0.93 in the Edmonton zone, 0.95 in the Calgary zone, and 1.13 for the rest of the province. As you know, any time that our reproductive number is greater than 1, it means our cases are rising. I know that many people have questions about when Alberta will move to Step 2 of easing restrictions. We are below the Step 2 threshold of hospitalizations, but we have seen growing cases in recent days. With that in mind, we will be taking the full 3 weeks to assess the data and assess the best way forward. No decisions on moving to Step 2 will be made prior to March 1st at the earliest. We are being cautious, as it is too early to say if this recent increase is significant or but a temporary pause in the strong downward trend we have seen over the past several months. As you know, residents in long-term care facilities have among the highest risks of severe outcomes from this virus. 2 out of every 3 deaths have been in a long-term care or designated supportive living facility. Over the last few months, we have seen a sharp decline in our long-term care cases. As this graph shows, we have gone from a high of 776 active cases in long-term care on December 27th to 63 active cases on February 20th, a 92% decline in less than 2 months. Similarly, the number of long-term care outbreaks with active cases has dropped from 74 on December 20th to just 5 on February 16th. Every one of us should take pride in this turnaround, as it is the result of not only our immunization campaign, but also of our collective efforts to bring our new case numbers down. The same steep decline is seen in designated supportive living facilities. On Christmas Day, we reached a peak of more than 1,300 active cases in these settings. Over the last 7 weeks, cases in these facilities have declined by 88%. These emphasize for us both that the public health measures have worked and that vaccines can have a tremendous protective effect for those who are most at risk. I want to thank the staff and residents in those continuing care and designated supportive living facilities for all of their work. I also know that over the past many months, we have also seen some concerning outbreaks in our hospitals, as well as a significant rise in the number of Albertans needing hospital care for COVID-19. Together, we have brought those numbers down as well, and both outbreaks in acute care and cases needing hospital admissions have declined, thanks to prevention of transmission in the community. From 27 acute care outbreaks at the start of January, we are now down to just 8. This is due to the hard work of many dedicated healthcare professionals across the province. I want to thank everyone who has worked to keep patients safe, as well as apply the learnings from early outbreaks to acute care settings across the province. I know that parents and many others have also had anxiety about safety in schools. As a parent, I understand these concerns and the desire to protect our children. That is why it is good news that, as you can see on this chart, the number of new and active cases in school-aged Albertans has gone down since classes resumed in person. While there are some day-to-day fluctuations in new cases, the overall trend is downward since students returned to school in person. Looking at active cases, on January 11th, there were more than 2,000 in this age group, and 6 weeks later, there were 747. That's a decline of 63% since schools reopened for in-person learning. And it's because together we have reduced our community transmission, and because students, teachers, school staff, and parents have worked every day to keep their schools safe. Finally, I know that many Albertans have lost a loved one to this virus. What we have accomplished together in bringing new cases down has prevented more families from having to grieve more of these losses. This final graph shows the decline in COVID-19 fatalities that have occurred over the last few weeks. As you can see, we have seen a downward trend in the number of deaths reported, from averaging a high of 167 deaths a week at the end of December to 23 over the last 7 days. When we talked about the leading indicators last week, the important points that we need to be watching for are whether or not those leading indicators are stable, are they declining, or are they increasing? And unfortunately, what we've seen over the past several days is that our positivity rate has started to go up, and that our R value has also started to go up in a concerning way. So we are seeing growth in several of those leading indicators. And in terms of what's concerning or not concerning, we want to see our case counts either being stable or going down, because when cases start to grow, if that's sustained over time, then we can get into a situation like we were in the fall. And that's why we need to take the full 3 weeks to be able to look very closely at where those numbers are coming from. Are there patterns? Are there things that we can do to be able to target particular locations and give us that chance to fully evaluate whether this is a few-day fluctuation or whether this is a longer trend that is concerning?